I think one of the things that's interesting is to be able to think about managing a patient from sort of the beginning when they come into your office till the end, which includes following them longitudinally in terms of preventing recurrent stones. And so in order to make that process feasible, you really have to build the infrastructure in your clinic or your practice or your hospital to make that happen. So we try to work with our partners in sort of emergency medicine, which is a big portal of entry for patients with new and recurrent stones. And then also primary care, they tend to see a lot of patients who have flank pain and get imaging. And then we have a group of nephrologists who actually help us co-manage patients in prevention. So what we've tried to do is have an open line of communication. And then to make that actually feasible, where we actually see the patients, we have a dedicated kidney stone clinic. We also have a nurse and a nurse practitioner who know kidney stone management very well and can triage patients. For example, for our recurrent stone patients who are known to us, have recurrent stones, we often put in an ultrasound order for them so they can sort of have a standing order. If they feel like they're having a recurrent event or they have flank pain, they can sort of call our office, get that order activated, and get some imaging to see where the stone is rather than having to go to the emergency room. So a good case that highlights our stone practice and all the processes that we put in place is a 75-year-old gentleman who came to the emergency room with right flank pain. He had no history of kidney stones, but does have a history of diabetes. And so in the emergency room, he did get a CT scan, which we see here. And coming into view on the right side of his kidney is a large 1 centimeter stone. Additionally, in his kidney, he also had a slightly smaller renal stone on the same side. His appointment was actually set up prior to his discharge from the emergency room to see us in our kidney stone clinic. And this is just a template here of one of our kidney stone clinics where the diagnosis that allows patients to enter this clinic has to be a kidney stone. And this case really highlights the ability, if you have a kidney stone clinic that provides easy access for patients who are seen in the emergency room or in primary care clinic, to be able to get in to see you rather quickly. So once he was seen in the office, we discussed his options, and since he had a rather large ureteral stone, we did discuss a trial of passage, but he elected for a primary ureteroscopy as he wanted to take care of this stone event rather quickly. So in the office, one of the important preoperative steps is counseling and setting expectations. And so we use the mykidneystone.com resources, which have animations as well as patient-friendly handouts. And this is just an example of one of the handouts we give to the patients and show them the visuals on what actually happens during surgery, how the scope looks, where the stone is located, how we remove it, and what to expect in the post-operative period. We feel that this provides patients with good information in the office and then something tangible to take home that they can reference later or show their family members who may be helping with them at home. So he elected for his primary ureteroscopy, and in the preoperative area, we again reiterate our expectations, what to expect in the postoperative period. And also we've started to collect patient-reported outcomes to get a better sense of how our patients experience kidney stones and the surgery that we offer, as well as a possible mechanism to evaluate or identify patients who might have significantly worse symptoms after surgery and who might need early reach out to either reassure them or triage them appropriately. And this is just an example of one of the questionnaires we provide in the pre and post-op area, as well as at home in the first 7 days after surgery about their pain. Once the surgery is done, we make sure that the implants we put in, usually stents and nephrostomy tubes, are appropriately removed and that no patient is lost to follow-up with one of these stents. So for us in our practice, we use our EMR, but there's other opportunities such as a spreadsheet or cards or commercial applications. This is just an example here of an implant log that is generated in our EMR, as well as the explant when it's removed in the office, usually 3 to 4 days later. We also find it helpful and important that our patients are given a specific date for their stent removal before surgery, so they know exactly where and when it's going to come out, and all our staff know as well when that stent is supposed to be removed. And finally, in terms of follow-up, at the date of his stent removal, he was provided with a 48-hour urine collection as well as serum screening labs. His stones were actually uric acid, and since this was his first stone, we did feel it important, given the stone composition, to discuss preventative measures with him. We also provided him with a prescription for a renal ultrasound to be done at 6 to 8 weeks later. This is just a picture of his ultrasound after surgery. What we're really looking for is hydronephrosis and any remaining stone fragments. In his case, he didn't have either. And so during this visit, we really discussed preventative measures in terms of preventing his uric acid stones. So I think in terms of what makes a successful stone practice is you have to think about all the phases of care, which includes the pre-operative, including access and how patients get to see you to get managed. And then the counseling process that happens in the office, especially if they're going to surgery in the peri-operative time frame, really setting expectations and managing how they're going to handle themselves in the post-op period, which includes follow-up to be sure that their stones are adequately treated, that any interventions you did are successful, and then to be sure that they're going to prevent stones from happening in the future. It is easy to do with planning and can make patients' lives easier in terms of getting access to you, and also make your practice more enjoyable by helping facilitate that care of patients with kidney stones.